Zika virus presentation. All right, so what is Zika? Zika virus disease is caused by the Zika virus, which is spread to people primarily through the bite of an infected mosquito. And these are the classification names of the two mosquitoes that carry the Zika virus. So how can you get it? So typically people think of the vector transmission through which they get from the mosquito bite, as you see right here. But that's not the only way you can get it. You can also get it from having unprotected sex with someone who has the virus. And it's very unlikely to have this, but you can also get it from a blood transfusion. But since they are screened for every disease that you think of before they are given to someone, it's very unlikely that you will get it from them, or from the blood. So where's it found? Since the virus is transmitted through the mosquito, it's mostly found where mosquitoes are at. So you're going to think of warm, humid climates like California, Florida, and Texas. And here's a map I thought was really good. It's from the CDC, and it actually represents how many people contract the virus. So as you can see, in Florida, Texas, California, places with warm, humid environments, except for New York and all that, they have the most because you think it's swampy, right near the ocean, lots of stagnant water, and you can see it's sort of just in warm climates. You don't see any up in, very little up in here.
Okay, so the signs and symptoms of Zika virus are fever, rash, joint pain, conjunctivitis, muscle pain, and headache. The symptoms are usually mild and only last a few days, and in most cases, hospitalization is not required. The Zika virus in pregnant women. The Zika virus can be passed from the pregnant woman to her fetus. Zika primarily spreads through the mosquitoes, as Timothy said. Infections during pregnancy can cause certain birth defects, such as microcephaly, which can cause developmental delays, eye defects, and vision loss. And according to the current research, Zika will not affect pregnancies that occur after the Zika virus is cleared from the bloodstream. And then when to seek treatment. If you have traveled to areas that are known to have Zika, if you've had sexual contact with someone who lives or recently visited an area known to have Zika, if you are pregnant and you have any of the symptoms of Zika, and if you're pregnant and you've been to those areas even if you don't have the symptoms.
Prevention of the Zika virus. There's no vaccines. You have to stay away from mosquitoes as much as possible. Practice safe sex with use of condoms and smell of female condoms. Wear long sleeve and pants that cover your extremities, especially when you go out. And they also say with your kids, you need to make sure their bodies is covered too if you live in those kind of areas where they're prone to be at. Use measures that protect your home from mosquitoes, such as screen windows and screen doors, and spraying the house with repellent. Wear a bow repellent spray. May not help totally, but can reduce the chance because repels the mosquitoes. Here are some ingredients that are very helpful in protecting against mosquitoes. There is pyridine, the oil of lemon, eucalyptus, and paramethandiol. Those are like some good sources that helps with this, preventing this. And here is a map. It said be aware of areas that Zika virus are known to be present. They say these are all where they're reported. So the North America, all South America, some of Canada, and a little bit over in this area.
Okay, so there's no specific medicine or vaccine for the Zika virus. They want you to get plenty of rest, drink fluids to prevent dehydration, take medications such as Tylenol or paracetamol to reduce fever and pain. Do not take aspirin and other non-steroidal anti-inflammatory drugs until whatever can be rolled out to reduce the risk of bleeding. If you are taking medicine for another medical condition, talk to your healthcare provider before taking additional medication. person's blood and bodily fluids, so urine, stool, vomit. If you are pregnant, you can care for someone with the Zika virus if you follow these steps. Do not touch blood or bodily fluids or surfaces with these fluids on them with the exposed skin. Wash hands with soap and water immediately after providing care. Immediately remove and wash clothes if they get blood or bodily fluids on them. Use laundry detergent and water temperature specified on the garment label. Use bleach. Using bleach is not necessary. Clean the sick person's environment daily using household cleaners according to label instructions. Immediately clean surfaces that have blood or other body fluids on them using household